commercial break. So let's talk about the prescription drug makers. They've got to benefit, right, with so many more people getting insurance coverage. What do you see there, and what's the investment play?
Well, right there, the pharmaceutical companies are going to benefit tremendously because now you've got 31 million Americans that are going to come into this plan. They previously didn't have prescription drug coverage, and pharmaceuticals are still less than 10 cents of every dollar spent on healthcare. So what you're going to have is you're going to have people utilizing this in a preventative fashion in order to prevent diseases from coming on, in order to treat themselves so they don't end up in the emergency room in the intensive care unit. So for pharmaceutical companies, for distributors, companies with innovative products, the volume from distributors is going to help on the margin flow because a lot more volume is coming through. And for pharmaceutical companies in general, they're going to profit as well.
Are you going to see more competitiveness from the generic makers? Will be there more motivation and more money supporting those and creating more of a competitive nature, generics versus the other pharmaceuticals?
Yeah, generics are certainly going to step up because there's going to be an increased utilization of generics, and it's going to be more pressure than ever before to utilize a generic when something is not available. What we're looking at for Americans in general is Americans in general have become very comfortable. It's like a great pair of Santoni shoes. They're hand-stitched, they're leather, they fit well, you're comfortable with it, and you like it. Well, people are very comfortable with their health care plan and the prescription plans right now. They love that too. But if you haven't had that before, now you're going to have something where you're not going to the drugstore and paying $380 for your drug. Maybe you've got a $20, $30, $40 copay, and you're going to be able to treat your family. So from that aspect, pharmaceutical companies will definitely benefit because the whole idea is utilize prescription drugs in order to reduce the long-term costs. If you do that, you're going to knock down the other 90 cents of a dollar spent on healthcare. The key is to do that.
Jeff, I have a question for you. I know you've looked at biologic drugs. They got a big victory in this Senate bill. They're protected for 12 years. What's the play for these more innovative cell-based drug companies?
Well, that's a very good point. One of the things was like one of those backroom dealings that was sort of overlooked. The biologic companies have been able to benefit because generic drug companies are trying to come out with generic versions of the biologics because now so many blockbusters are biotechnology products. Well, now they've got a secured path to prevent competition coming on, as was just mentioned, by an additional 12 years. That's going to be very key. Still, you're going to get competition coming out of the biotech companies that are involved in generics, such as Teva, which has a biologic division. But for pharmaceutical companies, there's now even more motivation to go out and make acquisitions, much like J&J about Senecor, et cetera. So you're going to see pharmaceutical companies, I think, increasing their acquisition pace of biotech companies because there's a safety window for them now for a longer period of time.
All right, quick breaking news note here. It looks like the president is going to be able to take his vacation. Jeff, it's because the Senate passed that health care bill. We were anticipating, we weren't sure if he was going to get to take his Christmas vacation, but we're waiting for him to leave. Looks like is that Air Force One or the helicopter? It's Marine One, it is. That picture's really far away. But anyway, so yay, the president gets his Christmas vacation because health care passed. Another topic I want to address with you quickly, Jeff, is the penalty for not carrying insurance. Is this going to work?
Probably not. Right now, if you're not carrying insurance, in the first year they're talking about phasing in like 2013-14, the first year would be $75 if you didn't have insurance. The second year would be $400. The third year would be $795. You've got to remember that by that point in time, a lot of people who aren't covered, let's just take kids. Kids can stay on their parents' plans basically until they're 26 years old. But if you're 27, 28, and you've got a several $1,000 health care bill, you may just decide to take the penalty and pay $75.
Got to leave it there. Jeff Kraws, CEO of Crystal Research. Thank you for your time and your insights today. Really appreciate it. Well, coming up on In Business, why the rally can last. Much more ahead.